Hi guys, it's Kevin, pharmacist in Dyser Pharmacy. I just thought I'd put out a quick video to answer some of the questions that we've been getting from patients during the week and today. It's been a very busy week, and I know there's a lot of people that are anxious and curious about what's happening with pharmacies and GP surgeries. Basically, we've had to very quickly implement some infection control measures to make sure that our staff don't get sick. We don't really know how many cases of coronavirus are out there, so because our staff are being exposed to people coming in all day, we need to take some extra steps to make sure they don't get sick and the pharmacy doesn't have to close, because that would be the worst thing. So you'll start to see us wearing masks in the coming days, and potentially face shields depending on how it goes. That's just purely to protect our staff, make sure that they don't have to self-isolate, and we can keep the medicine supply going. There's also been a huge increase in the number of prescriptions being ordered through GPs. Completely understandable. People don't want to run out of medication. If they self-isolate, they want to make sure that they've got enough. We are completely on top of that now. Vicky and the team have put in a huge shift during the week to get them all ready, and we will do our best to keep it that way. There have been queues as well, but that's also because of the fact that we've started restricting entrance to the pharmacy to 2 people at a time. And again, that's an infection control measure to enable us to ensure people have got adequate social distancing, so that they don't spread the coronavirus unnecessarily. The only other change that we've had is that we've started to close between 1 and 2. This is to enable essential cleaning of the pharmacy, so to keep it clean, reduce the infections and risk. We need some protected time to do that, and also to help us catch up on prescription volumes. There are some other opening hours have changed at some other pharmacies. It will vary pharmacy by pharmacy. I know some have decided to close the first hour and the last hour of the day to enable cleaning and to catch up. So do check with your local pharmacy. We've also been inundated, obviously, with prescription requests, and as well as people trying to buy paracetamol. I just want to reassure people that there is plenty of paracetamol in the supply chain. I know the supermarket shelves are bare, but we have plenty of stock of Calpol, paracetamol, that kind of thing. We've restricted the number of packs people can buy, because we obviously want to maintain supply for as many people as possible over the coming weeks, because we're in a marathon and not a sprint. And we want to make sure we've got stock for people that actually have symptoms, as opposed to people that are just stocking up their medicines cupboard. So don't worry about access to medicines. The supply chain is absolutely fine. There are obviously shortages, there always have been, and things are a little bit slower this week just because of the sheer volume, but pharmacies are doing their absolute best to catch up, so you don't need to have any concerns in that way. There's a lot of misinformation and wrong information floating around on social media, WhatsApp groups, that kind of thing. So I would just encourage people to keep up to date with a trusted source, and that would be nhsinform.scot. So that's nhsinform.scot is the website, and that will be kept up to date with the latest government advice about what you should be doing on a daily basis. Obviously, it's a very changeable situation. If you've got any questions or queries at all, do feel free to give us a call on 652 910, 652 910. If you're in a vulnerable group, I would encourage you not to come to the pharmacy unless you need to. Try and give us a call first. I'll put out a separate video just for people in vulnerable groups, but there's no need to put yourself at risk and come into the pharmacy. We can help you remotely. Okay, hopefully that was helpful, guys. Thanks.